My skin is better, my breath better, it's not bitter anymore.
Play basketball and baseball with my son, and just really an active guy.
I had developed some coughing that went away.
For the first year, I put $1 away every single day that I didn't smoke a cigarette. And yeah, $365, I buy some nice clothes.
He was about 3, and he picked up a cigarette butt from the street and was pretending to smoke like Dad. So I made the decision there and sought some help and was successful at that time.
There are plenty of good reasons to stop smoking. Most smokers know they need to quit for the good of themselves and their loved ones. And most smokers want to quit. Many people stop smoking and never go back. But for the majority of smokers, it's not that easy. Many people try to quit smoking a number of times before they succeed in quitting for good. It's not just a matter of willpower. Even people who are very self-disciplined have trouble quitting smoking and staying tobacco-free. Fortunately, your chances of quitting for good are much better today than ever before. In this program, you'll learn about new help that's available to you. We'll refer mostly to cigarette smoking, but be aware there is no safe way of using tobacco. Smoking cigars, chewing tobacco, and snuff are all dangerous to your health. But when you get tobacco out of your life, you do some very good things for your health.
There are the obvious effects over the longer term, that is reduction in their risk for chronic lung disease, reduced respiratory symptoms like coughing and production of phlegm, reduced risk of heart attack.
They breathe easier. They don't wake up every morning clearing their throat or wake up in the middle of the night to clear their throat.
People experience improved quality of life, improved energy, less fatigue, and sometimes we even find that other medical problems are easier to control.
Erectile dysfunction in men is one of the things that can occur in smokers, and it probably is an effect on the blood vessels. When people quit smoking, they may be able to regain that erectile function that they lost when they were a smoker.
If I have a patient who's smoking, I really try to convince them to stop smoking before the operation. Smoking as a process slows down the body's natural healing mechanisms, not only at the skin level where your skin incision occurs, but inside where most of the major surgery is occurring. When they stop smoking, they allow their lungs to heal. Not just their lungs, their whole body. They have better blood flow, better tissue oxygenation. In other words, our bodies are getting oxygen at a higher level, which improves healing. They'll make the operation a better operation.
When an individual quits smoking, I think it improves the quality of life for the entire family. We find that children have less respiratory tract infections. It's a cleaner living environment and better breathing air for the entire family.
With all of the good reasons to quit using tobacco, why is it so hard for so many people to do it? A big reason has to do with brain chemicals. Certain things like chocolate trigger the release of natural chemicals in the brain that make you feel good. Naturally, we feel an urge to keep doing those things. Often we can resist overdoing it, but some things are harder to resist than others. Tobacco contains a very powerful addictive drug called nicotine. When nicotine reaches the brain, it fits perfectly into a receptor that releases those feel-good chemicals. Tobacco provides the brain with very high amounts of nicotine. As a result, the brain creates even more nicotine receptors, all of them wanting to be fed with more nicotine. Those urges can be very hard to resist. When you stop using tobacco, the body experiences symptoms of withdrawal. Urges to relieve those symptoms can become especially strong, and smoking gets nicotine to the brain in less than 10 seconds. But over time, if you don't use tobacco, the urges gradually weaken. Nicotine receptors begin disappearing, and people enjoy the many benefits of being tobacco-free. The big question is, once you quit, how do you get through that period of withdrawal when you have strong urges to smoke? One of the most common treatments is nicotine replacement. This uses nicotine the way medicine is used, in measured doses. The brain continues getting some nicotine, but in smaller amounts, not as quickly, and in a much safer way than using tobacco.
It was really helpful. You know, I got enough replacement that I was never dying to have a cigarette.
As the withdrawal symptoms become less intense and easier to cope with, the amount of medicinal nicotine is gradually decreased. If you've tried nicotine replacement therapy in the past without success, you may not have been on the right dose or had the right combination of medications.
One of the things they were very mindful of here was determining what that dose needed to be. So if I needed more than one patch, which I did, I got more than one.
Don't give up on it. Talk with your healthcare provider. Nicotine replacement therapy might work on your next attempt to quit. Additional help has recently become available. Thanks to new ways of looking at the brain, there have been some important discoveries about easing withdrawal symptoms.
There are some newer medications different from nicotine replacement therapy. One that's been around for a number of years called bupropion. It stimulates the release of a chemical called dopamine in the reward center, the area of the brain that causes pleasure. And when people smoke, this dopamine is released. And dopamine causes that pleasurable feeling and reduces then the craving and withdrawal symptoms people get when they stop using nicotine. A newer drug called varenicline works in a much different way. It partially stimulates the nicotine receptor, and so it mimics some of the effects of nicotine and reduces withdrawal. But when it's in that receptor, when that drug is connected like a lock and key, it blocks that receptor so it can't be stimulated any further by nicotine. And those two effects combined tend to help people stop smoking by reducing withdrawal and reducing urges to smoke.
It's not only that I didn't have cravings, it's also I didn't really feel the need after about 3 weeks. I forgot my package of cigarettes, didn't miss it the whole day, and came home. And when I came home and I saw the cigarettes there, and I noticed that I hadn't had any need or any craving for them, well, that was the end of that package of cigarettes. It went into the trash, and that was it.
You know, there's no drug that's a silver bullet, but this drug certainly has had a positive effect in helping people quit smoking. We do use bupropion and nicotine replacement combination fairly frequently, and there's pretty clear evidence that that combination is better than treatment with nicotine replacement alone.
Studies have shown that these medications double the chance that people will stop smoking for good. As with any medication, discuss possible side effects and risks with your healthcare provider. Serious psychiatric symptoms, such as changes in behavior, agitation, depressed mood, thoughts of suicide, or attempts at suicide, have occurred in people being treated with bupropion or varenicline. If you are taking bupropion or varenicline, watch for these symptoms as well as for any worsening of pre-existing psychiatric illnesses. The symptoms may be complicated by nicotine withdrawal in people who quit smoking, but the symptoms also have occurred in people who continued to smoke while taking bupropion or varenicline. If you are taking bupropion or varenicline, you and your family need to watch for these symptoms. If they occur, stop the medication and immediately report the symptoms to your healthcare provider. Often, even after the withdrawal symptoms are gone, people still find themselves with the urge to smoke in certain situations. These urges are called cravings. They can be triggered a long time after you've successfully quit smoking. Sometimes, nicotine replacement therapy is used off and on for an extended time to help people cope with these cravings. Healthcare providers can also provide support to help people stay tobacco-free. Many providers are very well informed about the latest ways to help people stop using tobacco. It's very helpful to spend time with someone who understands your situation and can help develop a plan tailored for you. As with medications, it's been shown that a professional's help can double people's ability to quit smoking.
People decide when they want to quit. They don't have to quit the day they come to see us. So what my job is going to be is to explore when you're ready, if you're ready, and what kind of plan we can put into place specifically for that individual, arm them up with all kinds of tools and coping skills, and give them everything we can so that they have the highest chance of being successful.
If you've tried to quit in the past without success, it doesn't mean you can't do it. It just means it's hard. That experience can even be used to your advantage.
I fell back into it, but you kind of learn something each time you do it. You know, what would be better for you the next time around, or what you should avoid, or what, you know, steps that you should take to try and get through some of the cravings. So you kind of learn a little bit each time.
Some people quit smoking on their own, without medications or professional assistance. But many people need some help. Your healthcare team is there to provide it. Treatment can make all the difference. The combination of medications and working with a professional can increase your chance of quitting by 4 times. Of course, it will still take your commitment and determination to succeed. Ask your healthcare provider for information to support you in your efforts and a number you can call for help. Mayo Clinic has specialists in the treatment of tobacco dependence. Ask your healthcare provider how to make an appointment to see one of them. There are so many good reasons to quit. It can improve your health and appearance and enjoyment of life. It can also make medical treatments more effective and safer, reducing the risk of some complications. Talk to your healthcare provider about taking the first step toward independence from tobacco. It's a step toward better health and a brighter future for you and your family. This could be the time you stop smoking for good.
You know, I just feel good about having done it and feel good about what's happened in my life.
Being alive, being able to play sports, run, go to the gym, everything improved.
The taste is better, so the endurance smell is a lot better.
Our lives are happier. I'm healthy.
I'll be healthier, my parents will live longer, and they'll be healthier. It'll be a healthier home.